Lanny Virchow, and I'm the clinical care lead at Stanford Diabetes and Thyroid, and our PI project this year was I used to be and how to accurately measure height and weight on patients. So in an effort to be as efficient as possible, staff were observed verbally gathering height and weight or not gathering data accurately by requesting patients to remove their shoes or heavy coats, etc. The incorrect measurement of height and weight was observed by clinical staff, and without accurate measurements, patient status or health risk cannot be determined with any reliability. For example, if a patient who has osteoporosis is seen without obtaining the accurate height, the care team could fail to recognize that the patient is losing inches. In result, this may lead to the provider to believe that the current plan is being effective when it's really not. In the European Journal of Public Health, a study was performed comparing the results of BMIs from self-reported height and weight and measured height and weight. They found that measured values of BMI were most strongly associated with diabetes risk compared to self-reported values. So our plan was to take accurate heights and weights that were not being obtained by rooming patients in the clinic. Factors contributing to this included constraints related to the allowed time to room a patient, a desire to not make the patient feel insecure regarding height and weight, and the inability of a patient to independently remove shoes. So the people who participated in this were the clinic nurses and MAs of the clinic. What we did as far as interventions was to add visual reminders, provide coat hooks for patients to use so they wouldn't have to weigh with them on, and provide incentives such as coffee days to staff when doing interventions correctly. This took place at the Stanford Diabetes and Thyroid Specialty Clinic, and this was completed by March 4th of 2020. So we discussed interventions and the significance of obtaining accurate height and weight with nursing staff during morning huddles. Each week a new intervention was introduced, starting with collecting data to get a baseline and then moved to each intervention for a total of 4 weeks. We utilized a combination of reporting by observer and self-reporting on chart. We compared percentages of perfect assessment of height and weight, and our baseline data indicated that nursing staff were assessing an accurate height and weight on 24% of our patient population. This means that roughly about 75% of the time, patients seen in our clinic could be receiving less than optimal dosing of medications, and the provider's assessment of success of therapy was not as accurate as it could be. To combat this, we started the above steps that we mentioned for our interventions. So our study, our patients at baseline were being assessed approximately for height and weight about 24% of the time, like we mentioned. After our first intervention, the percentage of patients assessed appropriately went to 49%. So you can see here we started at 26 and it increased to 49. On our third intervention, which we anticipated would produce the highest overall percentage, showed that it was being taken accurately 62% of the time. We learned that the visual reminders and coat hooks showed the most improvement. So in the future, we will continue to obtain random sampling to ensure that accuracy has not dropped below current compliance of 62%. So we ultimately didn't achieve our end goal of 74% or better. It appears that the intervention which helps streamline the height and weight gathering process was the most successful. To increase our percentage of patients who are accurately assessed, we need to look at changes that can be made to make the process more efficient, as opposed to having incentives for the nursing. Interventions may include more prominent signage that requests patients to remove jackets and shoes. We will sustain our improvement by keeping staff aware of progress at staff meetings and quarterly coffee day incentives. And this information can be shared with other units and facilities. Thank you.